These days, I'm not sure that anything is as confusing to practitioners as how to figure out which material to use for what clinical situations. So what I'd like to do in this presentation is to walk you through a simplified way of classifying materials and then how those classes of materials can be applied to different clinical situations. So without question, you're going to have multiple materials available to you in your practice, because different ceramic materials have very different optical properties and in some instances very different physical properties. So for example, if we were to start looking at a patient like this who has had one of her anterior teeth restored with a single crown, and I'm hopeful that you can't figure out which one it is yet, and in fact it's a tooth that had endodontic therapy and it had a post-core, a metal post-core at that. And so we need a material that's able to actually cover that underlying tooth structure. So we have to have materials in our practice that can do things like that. In this particular patient, it was that left central incisor that had the endodontic therapy and the post-core done. And what I chose when I did this was actually a metal ceramic crown. Metal ceramics is able to completely mask that underlying post and allow the technician to have a very predictable view of what the final color will look like in the laboratory. So this is how that patient presented to the office. Here's what was underneath the old crown, and there was the restoration after we had redone it.